aspects of lymph stagnation and acidosis and nerve suppression. Both of those things leads to cell inactivity, cell damage, and on and on and on, all into the world of cancers and all the symptomologies that man experiences. So far, important to understand that a lot of times we are a neurological diabetic. I'll give you an example, and this is an interesting case. A lady came in the other day, 50 years old, and she had hurt her knee, her left knee, and she had had a surgical repair of that, and something went wrong, I don't know, but the surgeon had to operate 3 times on that left knee to get it back in shape again. Well, after the 3rd surgery, she went into type 1 diabetes, and she stopped menstruating. Now, this is very significant. Why? Why after the 3rd surgery would she then have type 1 diabetes and she stopped menstruating? And the answer was what I just led you up to. The answer is anesthesia is a neurotoxin. What it did is suppress the nervous system, the autonomic nervous system, and she couldn't produce insulin properly anymore. She also suppressed her pituitary and couldn't menstruate, couldn't produce FSH. So this suppresses head to toe, even the central nervous system. Go back to Michael Jackson again. So we have to wake up to what neurotoxins are, and they're everywhere. They're pesticides, herbicides, certain perfumes, deodorizers for bathrooms. The list is long. Be careful. You could be eating a nice big salad in a restaurant and go into an anxiety attack and shortness of breath because you forgot to clean the pesticides off of these vegetables. So the more sensitive you are neurologically, you will become very sensitive to these aspects. So when you're type 1, you want to always work on the kidney and adrenals. You always want to work on the lymphatic system, but you also can work on the pancreas. It's okay. They gave this lady a transplant of the islets, and of course they didn't take. Now they gave her a transplant of that. They put this lady through hell, and now she's came to us, and now she's rebuilding tissue again. She's fixing her nervous system, and now she's back normal again. But how interesting is that to understand that the nervous system can play a role in that? Type 1 diabetes should always be on fruit. Fruit. If you go up a little higher in blood sugar, just observe that. You'll probably glucose load for a while as you break down the fat in the body. And if you're having vegetables with fruit, you might see an upswing of glucose. But ultimately, you will see your glucose levels drop, and your blood sugar levels drop. And when you do, you be careful what you're taking. If you're on insulin or macrophage or some type of hormone there for that, you must be very careful, because it's easy to control blood sugars, and it's not too difficult after that to make the cells healthy again and not have that problem. Yes, type 1 is a more genetic problem, no question about it. You notice most people that have type 1 are younger. However, this one case of this 50-year-old shows you just that neurological compromising of the nervous system. So be healthy. Use herbs to help with this. Herbs are great at helping to improve the function of the adrenals, the kidneys, the pancreas. But always keep your diet to fresh fruits and vegetables. If you have to have some cooked vegetables, okay. Stay away from protein. Stay definitely away from fats. When you have blood sugar problems, you never do starch. That's complex sugar. Starch is polysaccharides.